this video, we will be discussing fungal infections and their management. I'll be covering the following points: types of fungal infections and their prevalence, ways to diagnose fungal infection, different classes of antifungal drugs, and challenges in managing fungal infections.
Sarah is a 28-year-old woman who has chronic obstructive pulmonary disease due to a hereditary genetic condition. To manage it, she has been taking corticosteroids for the past 4 years. In the last 2 weeks, she had shortness of breath, persistent cough with a sputum, and a fever. What do you think is wrong with Sarah? Sarah has actually developed a systemic fungal infection called invasive pulmonary aspergillosis. Although most people breathe in Aspergillus spores every day, those who are immunocompromised or suffer from lung diseases like Sarah are at higher risk of developing health problems that require antifungal treatment.
As you can see from Sarah's case, fungal infections are not limited to just superficial infections, which only affect the skin, such as oral and vaginal infections. Fungal infections can also be serious and systemic in nature, which affects the bloodstream and other body organs. For the rest of our video, we will focus on systemic fungal infections. There are 1.5 to 2 million deaths from fungal infections around the world every year. In Singapore alone, there are at least 100,000 cases of fungal infections every year. Since 2012, there have also been 11 cases of Candida aureus infections. These are superfungus with resistance to antifungal drugs. Even though the disease burden is significant, it is underappreciated and underfunded as compared to other diseases.
Fungi are a group of eukaryotic organisms. They are different from eukaryotic plants and animals because they have a substance called chitin in their cell walls. Fungi may appear as yeast. These are round or oval bodies and reproduce through budding. Candida and Cryptococcus are common examples of yeast. Fungi can also appear as mold. The Aspergillus and Mucormycosis species are common examples of mold. On the other hand, fungal can be dimorphic and appear as either yeast or mold, depending on the site of growth and temperature. Examples of these would be coccidioides and blastomyces. Fungi can be both helpful and harmful. Some are used in the making of antibiotics to treat bacterial infections. Examples of this include penicillin, which was extracted from penicillin fungi and the first ever antibiotic to be mass manufactured. On the other hand, some harmful fungi can also cause disease and even death.
Fungal infections are broadly divided into two categories. The first category is superficial fungal infections, which are common and affect a lot of people around the world every year, such as oral and vaginal infections. These infections are not life-threatening and are easily treated. The second category is systemic fungal infections, which can result in serious signs and symptoms such as fevers, chills, and low blood pressure. These infections happen in patients who are immunocompromised, as opportunistic infections, or as a result of exposure to invasive organisms in certain parts of the world. Systemic fungal infections are considered to be medical emergencies and can result in deaths, especially if they are not promptly treated. Common systemic fungal infections include candidiasis and aspergillosis. Candidiasis can cause both superficial and systemic fungal infections. Aspergillosis, on the other hand, is a mold organism that can result in serious fungal infections affecting the bloodstream and the lungs, and aspergillosis is frequently seen in patients with a severely compromised immune system. Fungal infections are spread through exposure to microscopic spores which people can come into contact with on their skin or are inhaled. In healthy people, these spores are cleared by our immune system. In immunocompromised patients, their immune system does not clear these spores adequately and therefore it results in an infection. Other than superficial infections of the skin, cases of systemic fungal infections are not contagious in nature. Another risk factor for systemic fungal infections is the use of antibiotics because antibiotics kill bacteria and result in an overgrowth of fungal organisms. Signs and symptoms of fungal infections are non-specific in nature and may be confused with signs and symptoms caused by infections due to other microorganisms. To check if a patient has a fungal infection, you should first look at their medications, check to see if they have immunocompromising conditions, and also to see if they have been exposed to fungal organisms from other parts of the world. For the diagnosis of systemic fungal infections, we can also obtain cultures from the bloodstream and all other potential sites of infections. For example, Aspergillus is an organism that frequently causes pneumonia. If we suspect Aspergillus pneumonia based on chest pain and shortness of breath, we should be performing chest radiography and bronchoscopy in order to establish the diagnosis. The diagnosis of fungal infections may also be made through other methods, such as by detecting the presence of fungal cell wall components, antibodies, antigens, and PCR testing. The early diagnosis of fungal infections is critical for its effective treatment. For superficial fungal infections, the choice of antifungal drugs is based on the location and severity of infection, as well as the identity of causative organisms. For systemic fungal infections, these are usually treated with several weeks of antifungal agents that are administered systemically, such as those belonging to the triazole, echinocandin, and polyein family. These antifungal drugs are usually administered intravenously at first and then converted to oral agents when patient improves. The triazoles work by inhibiting ergosterol synthesis. Echinocandins work by inhibiting glucan synthase. The only polyein that is used clinically is amphotericin B, which works by binding to ergosterol. Flucytosine is another antifungal drug that is in its own class. Flucytosine works by inhibiting DNA synthesis and is used together with amphotericin B.
There is significant global burden brought about by fungal infections. However, the current antifungal arsenal is limited, and many of the systemic antifungals are toxic to mammalian cells.
This is because fungi are eukaryotes and share a close evolutionary relationship with humans. Thus, drugs that are active against fungal cells can also work against our own cells, resulting in toxicity in human patients. The close evolutionary relatedness between humans and fungi also limits the number of unique fungal cellular targets that can be exploited for drug development. Finally, fungi can develop resistant mechanism, which is why some no longer respond to antifungal drugs. This happens under these circumstances. This is especially a concern for patients with invasive infections, such as those caused by the fungus Candida and Aspergillus. Antifungal resistance is a growing threat and should not be taken lightly, as the inability to treat invasive fungal infections that are resistant to first or second line treatment would lead to increasing disability and death. Long-term toxicities are also a concern, since immunocompromised patients have to undergo antifungal therapies for a prolonged period of time. For instance, nausea and GI disturbances from drugs such as itraconazole can make it difficult to tolerate for prolonged treatment courses. Currently, there are only 3 structurally distinct classes of compounds, namely polyenes, triazoles, and echinocandins that are therapeutic options for treating invasive fungal infections. Antifungal agents may be co-administered with several other medications to treat comorbidities, but this leads to issues with drug interactions. Specifically, azoles cause the most clinically significant drug interaction, since they inhibit CYP3A4 enzyme, which is responsible for the metabolism of various drugs. These affect the absorption, metabolism, and excretion of co-administered drugs. Like many other medications, dosages of antifungal agents may be adjusted in patients with compromised liver or kidney function to minimize potential toxicities associated with drug accumulation. Drug interactions can also require a change in antifungal dosing. Fortunately, the effects of impaired kidney and liver function on antifungal concentrations in the body can be anticipated based on pharmacokinetic properties of the specific antifungal agent. In certain situations, measuring the serum drug concentration of an antifungal agent can provide some guidance in drug adjustment or in the assessment of potential toxic effects. Although renal function can be assessed by a number of tests and procedures, creatinine clearance is typically considered to be the guiding factor for dosage adjustment. Typically, fixed adjustments in the dose or duration are made for antifungals predominantly cleared through the kidney as the glomerular filtration rate declines. However, these ranges encompass up to a tenfold range in renal function and may not be optimal for all patients. Therefore, antifungal dosing should always be individualized on the basis of kidney and liver function, medical status of the patient, and the severity of the infection. In patients with chronic renal failure who are receiving intermittent dialysis, the degree of antifungal drug removal is dependent upon the type of dialysis, the dialysis prescription, and the physiochemical characteristics of the antifungal drug. It is very important that the physicians caring for patients in the ICU are aware of the impact of such factors in the pharmacokinetics and pharmacodynamics of antifungal agents. In addition, they should be aware of the adverse effects of these agents that they administer on the biology and physiology of host various organs and the metabolism of other co-administered drugs occurring through these organs. This knowledge may lead to the optimization of doses of the antifungal agents and other interacting medications in order to maximize antifungal effect in the care of critically ill patients.
In summary, here are our learning outcomes from this video. Fungal infections can be categorized into superficial or systemic infections. They can be diagnosed through blood cultures or radiographic imaging. Fungal infections can be treated by 3 distinct classes of antifungal drugs. Challenges include antifungal resistance, drug toxicity, and dosage adjustments that are needed. There is a global burden brought about by fungal infections. Due to lack of new antifungal agents, it poses a biggest hurdle to its management.